Okay, so just picking back up, normal white blood cell count is from 3.5 to 10.5. And whenever you have an infection, it's going to be higher than 10.5. Um, and whenever it's lower than, sometimes, well, it can be lower than 3.5 if you have certain cancers. Certain cancers can make this white blood count low. And that's why some physicians are concerned when they see vegan vegetarians with their normal white blood cell count lower than 3.5. So essentially, your normal white blood cell count can fluctuate based on your needs for that day, for a different day. But typically it should stay between 3.5 to 10.5 range, but it can be lower if you're not dealing with a lot of inflammation, or and in some aspects it can be lower if you have cancer. That being said, one white blood cell, one granulocyte is a neutrophil, and neutrophils, the normal percentage is from 40 to 60% in your body. The percentage of white blood cells in reference to neutrophils is 40 to 60% in the blood. They're the most numerous amount of white blood cells in your blood, and the absolute count is 1.5 to 8 times 10 to the third microliters. So neutrophils are cells that they're the first line defense when we have bacterial infections. So these cells, they attack bacteria or certain invaders that are a bacteria, or say you have streptococcus or whatever bacteria that invades the body. These are first line defense for those invaders. Lymphocytes, they typically attack viruses, but like I said, they also respond to places when there's inflammation. So whenever there's inflammation, the lymphocytes are found. They also are, like I said, they respond to viruses like the coronavirus or different types of viruses. They also can be present when there is cancer as well. The normal is from 20% to 40%, the normal amount of cells in the body, lymphocytes in the body, from 20% to 40% of white blood cells. There's an absolute count of 0.8 to 5 times 10 to the third microliters. So this is the absolute count of lymphocytes in comparison to other white blood cells that are in the blood. Monocytes. Monocytes are, they're very efficient blood cells, white blood cells. They attack different different types of invaders. So, but one thing they're known to to be one thing they're known to attack are cancer cells. These are one cells that, besides the dendritic cell and natural killer cells, that are known to fight cancers. So normal is 7%. Whenever it's higher than 7%, you can be sure that you have either a parasite, you can have a high bacterial count or high viral count, but also maybe a sign that you have cancer. So absolute count is from 0.1 to 0.7%. Sorry, 0.7 times 10 to the third microliters. And whenever it's over this number, it could mean that you have an infection or inflammation, also cancer. Eosinophils, the normal percentage is from 2%. You don't want a lot of these cells in your blood. So the percentage, 2% of all white blood cells, is at most of that what you want. Whenever it's over 2%, that means you have a lot of allergens in your body. So for instance, if you have asthma or sinus infections and other things, allergens, these increase in your blood, and they release certain toxins that cause you to cough, that cause you to sneeze, that cause you to have redness and itchiness, so forth and so on. So eosinophils they attack even parasites as well, and they release their granules, the little small granules that you see in the cell, to basically kill the either get rid of the allergen or kill the parasite. The absolute count is 0 to 0.4 times 10 to the third microliters. And again, you don't want more than this because they can cause a lot of damage to your own blood cells, own tissues. And basophils are another type of cells. They have huge granules. And again, you don't want a lot of these cells around. They basically are around to attack parasites, but also allergens as well. Similar to the eosinophils. These you want normally 0% in your blood cell, in your blood stream. Again, you don't want too much of these because they can damage a lot of tissues around, but they are necessary for attacking parasites, funguses, and things like that. Absolute count from 0 to 0.2 times 10 to the third microliters. Now we're going to go on to the red blood cells. Speaking of which, I didn't include immature granulocytes, but you may see immature granulocytes on your blood lab report or results. Immature granulocytes are basically what they are. They're immature. They're not mature as the basophils or the neutrophils or eosinophils. And typically you don't want any of these in your red blood cell or in your blood stream, because that is a sign that you may have overproduction of white blood cells. Overproduction of white blood cells is called leukemia. So you may have cancers overproducing these cells, and they're spilling out of the bone marrow into the bloodstream. Think about it like this. It's like sending a 16-year-old to war, or sending a 10-year-old to war. They're immature, they cannot fight. But if you're finding a lot of these immature white blood cells in your blood, it means that you have cancer, cancer spilling out these immature 10-year-olds into your bloodstream to fight a battle. So red blood cells. For red blood cells, there's a lot of functions. There's one main function of the red blood cell is to carry oxygen. They also help to buffer our blood to make it less acidic or not too alkaline. There's other functions as well, but those are two of the main ones. The main one, though, is for it to carry oxygen. Without oxygen, all our cells would die. All our tissues would die. We would die if we don't have oxygen. And the red blood cell is very important for this. The normal range is from 3.77 to 5.28 times 10 to the third microliters. If you're higher than this, you can have a certain disorder called polycythemia vera, and you cannot efficiently carry oxygen if you have too much or too many red blood cells. Think about you're on a highway and you have too many cars traveling, or you have a traffic jam. That's what occurs if you have too many red blood cells. You cannot get the blood or get the oxygen from one point to the next if you have too many cars on the road, too many red blood cells on the road. Too little red blood cells, you're not efficient in getting your oxygen to your tissues, and you can end up with strokes, heart attacks, liver damage, kidney damage. Just basically, you destroy your tissues if you're not delivering the amount of oxygen you need to your tissues. Either too low of a red blood cell or too high of red blood cell count. You will not efficiently get your oxygen to your tissues. So the normal range again is 3.77 to 5.28. Hemoglobin is an important protein in the red blood cell, and hemoglobin, the normal for men is 13.5 to 17.5. For women it's 12.5 to 16.5. And again, in some labs it may be different. Some labs I've seen women 11.5 to 15.5, so forth and so on. But typically you see that the hemoglobin can fluctuate as well. For men, it's more than women. Typically, the men have more hemoglobin than women because we need more oxygen needs. We have more oxygen needs. And hemoglobin is basically what sits into the red blood cell, and it holds the oxygen to be delivered. It also releases the oxygen. So without the hemoglobin inside of the red blood cell, you cannot deliver oxygen appropriately. Hematocrit, normal is from 34 to 47%. And hematocrit will tell you if you're anemic, if you're polycythemic, or if you have too much red blood cells, it will tell you that. If you have too little red blood cells, like anemia, it will tell you that as well. So normal count is around 45%. You can see that in the picture. Normal is about 45%. But when you have polycythemia, when you have too much red blood cells, it's going to be higher than the 47% that we showed. If you have anemia, you're going to have less than the 34%. So it's just a measure of how much red blood cell your body has is making or has in its bloodstream. So mean corpuscular volume, MCV, normal is 80 to 100. And it also shows that, so in the middle of the red blood cell, again, is the hemoglobin. And it's a measure of how big, how large, what is the volume of the red blood cell. And the normal is from 80 to 100. So normal is from 80 to 100. And whenever you're over 100, it means that your cells are too large. If it's too large, it won't effectively deliver the oxygen. If it's too small, it's not effectively delivering the oxygen. It has to be within the 80 to 100 range. Mean corpuscular hemoglobin, MCH. Normal is from 26 to 37 picograms. And basically it's the how much of the what's the size of the red blood cells in comparison to the hemoglobin. And I'm sorry, vice versa. How big is how much is the hemoglobin in comparison to the red blood cell? So you can see the diagram. If your body's not making sufficient amount of hemoglobin, it could compromise your ability to carry oxygen. Again, the hemoglobin, there are two proteins, heme and globin. If your body's not making those proteins, it can compromise the way that you're carrying oxygen. And if you're making too little of the hemoglobin, you're going to have a hyperchromic cell. This is the cell to my left, and that's not going to deliver the oxygen that you need. Or if you have a hypochromic, which is the cell to my far right, that's too big and it's not going to deliver the oxygen appropriately. So you need your mean corpuscular hemoglobin to be 26 to 37 picograms. Within that range, you're delivering your oxygen appropriately. And mean corpuscular hemoglobin concentration. So similar to what we just talked about, mean corpuscular hemoglobin, but this measures if you have, for instance, sickle cell anemia. If you don't have regular normal cells, this can tell you that you may have a disease like sickle cell anemia or hereditary spherocytosis or thalassemia, things like that, based on the amount of hemoglobin that you have per cell. So if it's over 36 grams per deciliters, you can be sure that you have something. You can have an iron deficiency, for instance, or you can have things like hereditary spherocytosis or sickle cell anemia or thalassemia. If it's less than that, you can have different diseases as well, but your body likes your mean corpuscular hemoglobin concentration to be within 31 to 32, 36 grams per deciliter. If it's not, then you have a deficiency in bringing oxygen to the body. Red cell distribution width, or RDW, the normal is from 12 to 15%. Normally they don't measure, or there's not a disease that's named for when you have a RDW, or red cell distribution width, that is less than 12. It is only measured mostly to see if you have a red cell distribution width that's over 15. And whenever you're over 15, it could mean that you're iron deficient. So if you have a red cell distribution width which is 17, it can mean that your iron is low. So if you go to the doctor, I don't have an iron study, I haven't run an iron lab yet, and your red cell distribution width is 17, I can be sure that more than likely you have an iron deficiency. You don't have iron in your blood. I have to check your iron levels just to make sure that it is an iron problem, because it can be other issues with concerning iron, but it could be other issues, not just you not getting adequate iron, but for instance, I can have something called anemia of chronic diseases, where your body's holding on to iron. You have a lot of iron, but your body's holding on to it because it's trying to prevent growth of bacteria or growth of cancer cells. Some cancer cells or some bacterial cells, they basically thrive off of iron. So your body will hold that iron so that those cells can die. So essentially, I will have to do another follow-up blood test to figure out what is the problem. Is it iron deficiency, which is more commonly, that's the issue, or is it an iron deficiency based on inflammation or a chronic disease, or kidney disease, or inflammation, so forth and so on. If this is not clear, please let me know. Whatever is not clear, I'll try to answer questions as much as I can. Platelets are, normal count is from 150 to 380 times 10 to the third microliters. And platelets are very important for clogging. Whenever we get cut, for instance, platelets are the first cells on the site to stop the bleeding. So if you're platelet deficient, you cannot stop bleeding. You cannot stop the bleeding from cuts, from whatever cause of bleeding. You cannot stop it. And sometimes we have quote unquote microbleeds. For instance, if someone has hypertension and high blood pressure will cause little cuts and tears in the red blood in the blood vessel, and the platelets will basically clog up those cuts. You don't know what's going on in your body, but the platelets are causing the 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 healing of that blood vessel. If you have too much platelets, too many platelets, say you have 450 consistently, or 600, or 700 consistently, you are prone to clots, blood clots, and blood clots can cause strokes, heart attacks, but also pulmonary embolisms, where the clots go to your lungs and you cannot breathe in sufficient oxygen, and you have shortness of breath and chest pain, and so forth and so on. So too much is a problem, and too little is a problem. Your platelets, normal count of platelets should be 150 to 380. Now for the basic metabolic, basic metabolic panel. These tests are done to see the health of your organs, specifically the kidneys and the liver. So in regards to kidney function, there are some tests that you can run for kidney function. First, we spoke about the kidneys when we spoke briefly about the kidney when we talked about the anatomy and physiology. But the kidneys are very important. They're a very specialized organ. And they basically remove the urine or remove the waste from the body, but they're like great mathematicians. They're great calculators. They calculate how much sodium you need for your body's needs, or how much electrolytes like sodium, how much potassium, how much magnesium, how much chloride, how much phosphorus you need in your body, and it'll calculate what you need. It will put back into your body what you need that comes to it. So all of our blood goes to the kidney. The kidney decides how much potassium, how much chloride, how much phosphorus my body needs, and it will leave that into the bloodstream, or put that back into the bloodstream, and takes out of the bloodstream what you don't need. So if your potassium is too high, your kidney will function to take that out of your take the excess out of your blood, and basically makes it as waste. But there's other waste in our bodies as well, which we'll get into. That every day our body creates waste, and our kidneys filtrate or filter all this waste product out of our system and makes into urine. Again, our kidneys filter the blood and calculates what we need and what we don't need. And there is an equation, or a marker called glomerular filtrate rate, or GFR. And the glomerular filtrate rate, normally you want it to be over 90 mLs per minute per 1.73 meters per meter squared. And the glomerular filtrate rate just says over 90. Anything over 90 is good. And it's different since on some lab reports, there's a difference for African Americans or Black people. There's a different reading for African Americans or Black people in comparison to Caucasians or Asians, and so forth and so on. So the standard number, that is a standard number for Caucasians and Asians and other people. But for African Americans, for Black people, there's a different standard. There's a different number for African Americans. The reason being, it's a calculation, and these calculations don't calculate certain things that are, or it does not get completely some aspects of like proteins, for instance. The amount of proteins that we have can vary, especially if you're of African American descent. That being said, the glomerular filtrate rate, if you're ever spilling proteins in your blood, they'll consider you having kidney damage. If you have a GFR of 90 and you're spilling proteins in your blood, you can have kidney damage, stage 1 kidney disease. If you have a GFR that's 60 to 89 and you're spilling protein in your blood, you can have a stage 2 kidney disease. If you have a GFR of 30 to 59 and you're spilling proteins in your blood, you have a stage 3 kidney disease. And they split these up. You have stage 3A, which is 45 to 60, and stage 3B, which is 30 to 45. But that's stage 3 if you're spilling protein in your blood. Stage 4 is if you're spilling protein in your blood and you have a GFR of 15 to 29. And at stage 5, when you have less than 15, your GFR is less than 15, that's when they want to put you on dialysis. Now, if, say, for instance, you don't have proteins in your, I'm sorry, I said blood, proteins in your urine. If you're not spilling proteins in your urine, and you have a GFR of 75, you're not considered as having stage 2 kidney disorder, stage 2 kidney disease. You basically just need more water. The glomerular filtrate rate increases as much as we increase our water intake. So if your GFR is ever low and you're not spilling kidneys in your blood, you may need to just drink more water to increase your GFR. The kidney loves hydration. So the more water you drink, the better the kidneys function. And BUN is one of those, is one of the waste products that our kidneys get rid of. So BUN, it's basically from protein synthesis, and we make this waste product from synthesizing proteins. And the normal range should be 7 to 24 milligrams in the blood. And so in the blood, you don't want more than 24 milligrams per deciliters. And sometimes when you have less than 7 milligrams per deciliters, it means that you're not getting a lot of proteins in your body. So someone who's elderly may have a normal, elderly and don't have a lot of proteins, or they're losing weight, may have a BUN less than 7. But essentially, this is a waste product. Our bodies processes proteins and different things and produces the waste product BUN and sends it to the kidney to get rid of it. And your kidney will get rid of it. If it accumulates in our bodies, it could become a toxin and damage our tissues. So the kidney has to efficiently get rid of it. And this is why we need things like dialysis, because if we have BUN increasing in our bodies and our kidneys are not functioning properly, then we need dialysis to take out these waste products, because it becomes BUN becomes a toxin to our body, and it can damage our tissues, even leading to death. Creatinine is another waste product. Creatinine is a metabolite or a waste product from creatine, and creatine creatinine is a waste product that comes from creatine that the muscles make. So the muscles send creatinine to the kidneys to get rid of, basically, and it's a product that comes from creatine that the muscles use to create energy. So the normal range is from 0.6 milligrams per deciliters to 1.2 milligrams per deciliters. That means this is the amount that needs to be in the blood. If it's ever more than this, then that means there's a problem with the kidneys getting rid of this waste product. If there's less than this, again, it could mean that you're not getting a sufficient amount of proteins or different sources that your muscles need to work properly. Different resources. So again, it's a waste product, and your kidneys get rid of it. And whenever whenever it's over 1.2 milligrams per deciliters, let's say it's 5 milligrams per deciliters, they can use this as a staging for the severity of your kidney disease. So a nephrologist, basically, or kidney doctor, will use this to say, I need to take off this amount of fluid from this patient because he or she has this much waste product in his blood or her blood. So they can use it to gauge how much, how worse your kidney function is, and to use it for dialysis to take out a certain amount of blood from your waste from your blood. Uric acid, if you've ever heard of gout, uric acid is a waste product that once it accumulates in your blood, it can cause a very painful disease called gout. And if you ever have had gout or seen someone with gout, it's very sensitive. Some people say they can't even sleep with gout. Their toes usually happens on your big toe, but it can occur in your knees, anywhere there is a joint, basically, that's where it can occur. And normal range for uric acid is less than 6. Whenever it is over 6, you're more prone to gout. And you can get gout from different things, eating shellfish. You can increase your uric acid, meats as well. Certain vegetables can increase uric acid, but less so than the shellfish and the meats. So again, whenever you're over 6, you're more prone to gout. And you can have gout multiple times during the year as well. And well, essentially the kidneys gets rid of uric acid, and if the kidney's not functioning properly as well, if you're getting too much uric acid in your blood by taking the shellfish or meat or different things, that could be a problem. If your kidneys aren't efficient enough to get rid of the uric acid, and it can cause gout. Or if your kidneys are compromised, the kidneys aren't working properly, you can have a buildup of gout, even if you're not eating shellfish or fish or meat and all these things. If your kidneys are compromised, then your uric acid will increase, and that will lead to gout. Electrolytes. We have a lot of electrolytes in our body, but the main ones that are measured on tests are sodium, potassium, chloride, and calcium, and also bicarb, which is HCO3. But electrolytes are very important for strength, for energy, for hydration, so forth and so on. And sodium is one of the most important electrolytes in our bodies. Normal is from 134 to 144 milliequivalents per liter. And sodium helps to maintain blood pressure. And again, without blood pressure, if your heart is not pumping efficiently, if not creating a amount of pressure that it needs, you cannot get blood to your brain, you cannot get blood to your kidneys, you cannot get blood to your liver, you cannot get blood to your pinky toe, and these tissues will die. So you need sodium to maintain your blood pressure. But again, too much sodium can lead to high blood pressure. Too little sodium can lead to low blood pressure, and this can cause issues. So your normal blood pressure should be, normal sodium should be 134 to 144 milliequivalent per liter. And sodium is very necessary for homeostasis, or the balance of processing in your body. Chloride, you can see NaCl, basically. Chloride is the Cl portion of the NaCl, and NaCl is basically table salt. So salt is very important for our bodies to be efficient, not only for our blood pressure, but also to maintain electrical current in our bodies. So for instance, our cells, in order for them to fire, or in order for them to process, they need the sodium and chloride to work efficiently, or to have an efficient amount of a normal amount of sodium and chloride for your bodies to work efficiently and function properly. For your nerve cells, for instance, to fire, you need the sodium, the chlorides to be abundant, or the necessary amount of those things to be in your body. So your nerve cells can fire, or your heart cells can fire, or other cells to work properly. You need these electrolytes. So normal chloride should be from 95 to 103. And whenever it's over that, you can have a problem. Whenever it's under that, you can have a problem as well. Potassium is very important as well. You have more potassium in your cells than outside of your cells. So especially for your internal environment of your cells, all your cells, nerve cells, heart cells, liver cells, kidney cells, you need potassium for health and also for it to function properly. So normal is from 3.5 to 4.5 milliequivalents per liters. Whenever you have more than 4.5 milliequivalents per liters, it's very serious. You can die from a heart attack. You can die from strokes and different things like that. And also your muscles don't work properly whenever it's over or even less than 3.5 or over 4.5. So your potassium range has to be between 3.5 or 4.5, or your body will not function properly. As a matter of fact, in the US, they use for when someone is being executed, they'll use for like a crime they committed or something of that sort. They'll use high dose of potassium, very, very, very high dose of potassium, and they'll inject it into the person's arm for lethal injections. And this person, basically their heart stops, their brain stops, they cannot move because of the high dose of potassium. So the high dose of potassium bombards the kidney cannot get rid of all this potassium, and basically everything stops functioning. So you do want to keep your potassium within that range. Whenever someone has a kidney disorder, they'll tell people who have kidney disorder or on dialysis, don't eat a lot of bananas or don't eat a lot of things that have a lot of potassium, because it can basically stop your heart functioning or stop your muscles, make you fatigue. If you have too high of potassium, they'll even do dialysis to take off the potassium. Calcium is very important as well. Your heart cannot function, your muscles cannot function. You cannot clot your blood without calcium. They transmit nerve impulses, muscle contraction. All these things are very important. These are just some of the functions of calcium in the body. And normal calcium is from 8.4 to 10.5. If you're over 10.5, you can have an increased transmission of nerve impulses. So you can have twitches, or you can have strokes, you can have seizures. Basically, if you're over 10.5, say 11 to 15, that's when you start having these things. You can also increase the clotting of the blood if the calcium is much more than it should be. If it's less than that, you can also have the reverse. You cannot have sufficient impulses of your nerves to conduct, your nerves cannot conduct energy to send an impulse from one area to the next. Or your cardiac function will be decreased or depressed. Your clotting of your blood will not be appropriate. So calcium is very important, and your kidneys maintain the regular range of the calcium as well. Magnesium is not typically measured on a regular labs, but magnesium is the fourth most abundant or fourth most important and abundant electrolyte in our bodies. And normal range is from 1.7 to 2.2 milligrams per deciliter. It is said that approximately over 90% of people are magnesium deficient. And whenever you have a magnesium deficiency, it can cause things like headaches or high blood pressure or kidney problems or heart problems, or even, for instance, your vitamin D levels. You can take vitamin D, but if you don't have sufficient magnesium, your body cannot absorb it, and your body cannot use it properly. So magnesium is needed for for over, I think, 400. Don't quote me on this, but there's a lot of functions in your body that requires magnesium. And if you don't have magnesium, sufficient magnesium, even your immune system, it needs magnesium to work efficiently. And if you don't have sufficient magnesium, then your body will not work properly. But your kidneys maintain your magnesium in your blood. This range of magnesium in your blood. So blood glucose and diabetes panel. This is another part of the basic metabolic panel. And the blood glucose, the normal ranges from 70 to 90 milligrams per deciliters. This is the quote unquote US range. You'll also probably find millimolar per liter. This is what you find in many countries as well. So abnormal fasting blood glucose is over 125 milligrams per deciliters 2 times. I apologize. I don't know the millimolar per liter for these, or it slips my mind at this point. But I will try to get an answer for you if you need. But fasting blood glucose is if it's over 125 milligrams per deciliters 2 times, you're considered to have diabetes. If you have an oral glucose tolerance test, meaning they give you an oral glucose challenge or sugar challenge, and you're over 200 milligrams per deciliters just once, you're considered to have diabetes. But you essentially want your blood glucose to be within 70 to 90 milligrams per deciliter. And hemoglobin A1C. Your hemoglobin A1C is a test that measures the amount of glucose molecules that is sticking to your hemoglobin. Remember, the hemoglobin is the protein in the middle of your red blood cell. So glucose is sticky. If you were to spill sugar on your hand and you let it dry, that area becomes sticky. And same thing with inside your body, the sugar, the glucose, which is the form of sugar, becomes sticky, and it sticks to all of our cells. Particularly, it sticks to the hemoglobin of the red blood cell. And they can measure this, how much hemoglobin, how much glucose is sticking to our hemoglobin to show just how our daily blood glucose has been. And if your hemoglobin A1C is 4.8 to 5.6%, that's a normal amount of glucose sticking to your red blood cells or sticking to your hemoglobin. If you're pre-diabetic, this number will be 5.7 to 6.4%. If you're diabetic, it'll be over 6.5%. Now, in addition to this, your red blood cells have a lifespan of 90 days. So from 0 to 90 days, they can measure your daily blood glucose average for 90 days. And this number, either the hemoglobin A1C, this number is a measure of, for the past 90 days, for the past 3 months, what has been the average blood glucose levels? How much glucose is sticking to my hemoglobin of my red blood cell for 90 days? So whereas, for instance, I go to the doctor and my blood glucose, my regular blood glucose is within 70 to 90, and it's normal for that day. Say you fasted that night and you went to the doctor, and the doctor sees that your blood glucose is 70 to 90, they'll say, "Oh, your blood glucose levels are good. It's not abnormal. You don't have glucose. You don't have a glucose problem or diabetes." They can do this test, the hemoglobin A1C, to see what has been the average blood glucose levels for 90 days. So whereas the blood glucose levels from 70 to 90 for that day is normal, what has been your average for the 90 days before you came here? And they can actually diagnose you as pre-diabetic, even though your normal blood glucose is for that day is normal. So again, you're pre-diabetic if your 90-day average of your blood glucose levels are from 5.7 to 6.4%, or you're diabetic when you're over 6.5%. So again, it's a 90-day average of your blood glucose average or range during the 90 days, and it can tell you if you're diabetic or not. So the hemoglobin A1C is something that is used most commonly now to diagnose people with diabetes, because you can have a less accurate daily blood glucose, which doesn't tell the bigger picture of what your blood glucose has been for 90 days. But again, normal is 4.8 to 5.6, pre-diabetic is 5.7 to 6.4%, and diabetics are 6.5%. And they can actually tell based on your hemoglobin A1C what has been your average or estimated blood glucose for 90 days. For instance, if your A1C is 5, it shows that your estimated average blood glucose is about 97. But it can range from 76 to 120. If your A1C is 10, that means your average blood glucose levels is 240, and can range from 193 to 282, and so forth and so on. You can have a hemoglobin A1C up to 16. I've seen people up to 17. Based on your A1C, it also tells the doctor how severe your diabetes is. Oh, also to my far right, you'll see the calculation for millimolars per liter, which is what is used in many of the Caribbean countries, and also Canada and the UK. So for instance, a blood glucose level of 97 is 5.4 millimolars per liter. A blood glucose of 126 is a blood glucose levels of 7.0 millimoles per liter. I don't recall the calculation for that, so apologies for that. Insulin. This is not so much a regular test, but you can ask for an insulin test. And insulin basically is a hormone that is from your pancreas, and the pancreas releases this hormone, and it acts like a key. And the key goes to the cell, opens the cell door, and the glucose goes into that door, so the cell can have its energy needs, fulfill its energy needs. When you don't have insulin, the glucose stays into the bloodstream. It does not go inside the cell, it stays in the bloodstream. So someone who has type 1 diabetes cannot make insulin, cannot make the key to open the door so the glucose can go in. If you have too much insulin, if you're making too much insulin, that means that you're making too much, or you're taking in too much glucose for your needs. And it comes to a point where someone who is a type 2 diabetic, if they make too much insulin, they will tire out their pancreas, and the pancreas cannot make the insulin. It gets tired, it gets overworked, and it does not make as much insulin as it needs. And that's where type 2 diabetics will need insulin. Now, when that happens, um, again, you need insulin, but we have something that's called insulin insensitivity, meaning when you're type 2 diabetic, no matter how much insulin you make, your cells are very insensitive to the amount of insulin that you're making. It's like something is blocking the door, and the key that used to work doesn't work anymore. The insulin doesn't work anymore, and the pancreas keeps making more and more and more, trying to send more keys to that door to unlock the door. But it gets to a point where your cells are not responding to the insulin, one, but also your pancreas gets tired and stops making insulin. And it necessitates your doctor giving you synthetic insulin so your body can work efficiently. One thing to consider when we talk about exercise, we'll talk about it more. But basically, when we exercise, we basically open the door to our cells automatically. We don't need insulin. When we exercise, our cells say we need this energy. So we'll tell the door to the cell to open up, regardless of the amount of insulin that we have. The doors open up and the glucose goes inside of the cell. So exercise is the best way to defeat diabetes, because regardless of insulin, the insulin that your pancreas is making or not making, your cells will open up. But also exercise helps the pancreas to not produce as much insulin, and to also recuperate from its fatigue as well. So ideally, insulin should be less than 8. 4 to 5 is even better. And again, normally this is not a normal value that is received, but you can ask for insulin to be added to your results as well. Complete metabolic panel. This is basically more tests that you can see how your lipid panel, for instance, or see how your liver is working and other organs are working as well. So liver function and serum proteins. Liver is a very important organ. It does a lot of things, as we said before, so much so that we had a joke in medical school. And the joke was basically, why do they call the liver a liver? It's because without a liver, you could not live. So basically, without a liver, I've seen people die within days, within hours, without a liver. They need a liver transplant. They can't get the liver transplant, and they die within days. Some within hours, depending on their need. So without a liver, you cannot live. There's a lot of processes that are important to our bodies that our liver functions to provide for our bodies. For instance, protein synthesis. Without protein, we would die. And the liver is the main or the primary, the only organ that makes proteins. The immune system as well depends upon the liver. Metabolism, or the conversion of your thyroid hormones, depend upon the liver. So if you have a thyroid problem, it may not be your thyroid. It could just be your liver needing to be detoxed. Also, detoxification of fats, detoxification of drugs, detoxification of a lot of toxins in our body, the creation of urea, for instance. If your liver is not functioning properly, then you will not detox drugs and all these bad toxins from your body. Production of sex hormones or vitamin D. You need your liver to make sufficient steroid hormones and vitamin D as well. The storage of nutrients or macronutrients like B12. B12 is stored in your liver for up to 5 to 8 months. Vitamin A, D, E, and K, these are also important vitamins that are stored in your liver. Minerals like copper and zinc also. It also stores glucose and stores fat as well. It produces bile. It does many things. It makes proteins for your like hemoglobin or the precursor to hemoglobin, the precursor to globin, the HDL. Those are proteins. LDL. Those are proteins that your liver makes. Liver is very, very important. That being said, one of the most important thing it does, it makes proteins. The normal range of protein that should be in your body is 6.0 to 8.5 milligrams per deciliters. Ideally, you want it around 6.5 to 7.5. Whenever you're over 8.5, it could be a problem. Whenever it's under 6.0, it could be a problem. So you want to keep it between that range, within that range. But again, a lot of the proteins that our liver makes, our body uses to make, like red blood cells, for instance, or it uses it to make to make cholesterol, or carry fats, to carry iron, to carry different things in our bodies. So without the liver, basically our entire processing of the functions of our body would shut down. Albumin is one of the most important proteins in our body, and is 80% of the proteins that our body makes is albumin. And normal is from 3.5 to 5.0 grams per deciliters. Whenever we have more than 5, it could be a problem. It can cause a lot of issues in our body, like that's called a traffic jam, basically, because the protein, they float through our bloodstream, and they can cause blockages if there's too much of them. Or if you have less, it can also be a problem. If you have less than the normal amount of albumin, we cannot transport certain things, like calcium, for instance. Calcium is transported by albumin. And if we have less of the albumin, then we cannot take in the calcium. We cannot manage the calcium that we need. And again, calcium is very important for a lot of functions in our body. A globulin is the remainder of the proteins that we make. So albumin is 80%, the globulin is 20% of the proteins that we make. And there's different types of globulins. There's immunoglobulins, for instance. Immunoglobulins are important for our immune systems. There's also alpha globulins, beta globulins, gamma globulins. But these globulins, for instance, are important for red blood cells and their processing, or the delivery of cholesterol from one area to the next. The normal globulin ratio is from 1.5 to 4.5 grams per deciliter. Bilirubin, if you've ever heard of jaundice, jaundice is when someone has yellow skin, yellow eyes, itchy skin, and can actually cause death. Or babies, excuse me, sometimes babies are born jaundiced. And it's a direct correlation of the processing of the liver. Sometimes when babies are born, their liver is not working properly. So they have the yellow skin, the yellow eyes, and they can have something called kernicterus. Kernicterus is where the bilirubin affects the baby's brain, and it can cause permanent brain damage. So controlling the amount of bilirubin in our bodies is very important. And the liver keeps the range from 0 to 1.2 milligrams per deciliter. Whenever it goes over 5, it goes over 8, then you start noticing the yellow skin, yellow eyes, itchy skin. But it can also cause, like I said, neurological disorders as well. So the bilirubin is a measure of how well the liver is getting rid of waste products, and either sending it to the urine or sending it to the feces. And again, the liver is very important to get rid of waste products in our bodies, just like bilirubin and urea, so forth and so on. Alkaline phosphatase is a protein or enzyme that our our liver makes. It's also made in the blood, the bone. And alkaline phosphatase is used to see if our uh, liver is functioning properly to make this type of enzyme. It's a very important enzyme, and most of the processes, most of the functions of alkaline phosphatase, we don't know at this point, to be honest. But most of the processes that we do know is a very important enzyme. And if our body is not making it, for instance, our bone makes it for the regular calcification of the bone. So if we don't have it in our bones, for instance, your bones cannot be as sturdy as they need to be. But alkaline phosphatase spills out into the blood when our liver cells are damaged, or if our bone has, say we have bone cancer and we're making a lot of alkaline phosphatase, then most of that spills out into the blood, and we can see if using this test, if we have a liver problem, either the liver cells are being destroyed, or I can have a bone problem. Either the bone is making too much alkaline phosphatase, which more likely mean we have a bone issue like cancer. So alkaline phosphatase is used to decipher if we have a liver problem, but also we can use it to decipher if we have a bone problem as well. AST is another enzyme, and it's an enzyme that's used to use amino acids to convert them into other amino acids. So we can take in, like, for instance, an essential amino acid and make a non-essential amino acid. Remember, we spoke about amino acids and how we have there are 9 to 11 essential amino acids that we need. Our body needs to take in those amino acids. And there are over 21 amino acids, and we can use essential amino acids to make non-essential ones. And AST is one enzyme that converts essential but also non-essential amino acids into other amino acids. And whenever our bodies are, whenever our hepatocytes, whenever our liver cells are injured, this enzyme spills out into the blood. So for instance, if you have a viral disease like hepatitis A or hepatitis B or hepatitis C, this will spill out into the blood. Or if you have fatty liver, for instance, this will spill out into the blood. And if it's ever over 40 international units per liter, then we know that there's a problem, like a viral infection or a fatty liver. Again, normal AST ranges from 0 to 40. Ideally, you want this to be like in the teens, like 17, 15, so forth and so on. Whenever it's over that, sometimes it could be an indication of damage to the hepatocytes, like fatty liver, for instance. Or when it's very super high, it could be an indication of viral infection like hepatitis A, hepatitis C, so forth and so on. ALT is similar to AST. ALT is particular to the liver. Think about AL as liver. AST, you can find it in the heart as well, and different areas of the body, but ALT is specific to the liver. And ALT, the normal is from 0 to 32 international units per liters. And similar to AST, whenever we have a viral infection or fatty liver or muscle damage, for instance, we can have an increased amount of ALT in our blood. And normal is from 0 to 32 international units per liter. So whenever it's over 32, or say it's 50, we can be sure that there's an issue with damage to the hepatocytes or liver cells. And again, you want, similar to the AST, you want these in the teens, the amount, and in the blood, you want these to be in the teens from 0 to 15 or 14. That's important to have that amount. GGT is another enzyme This enzyme is made by there's a duct that leads from the liver to the gallbladder, and from the gallbladder to the pancreas, and from the pancreas to the duodenum. This duct um, delivers bile, but also pancreatic enzymes to the small intestine. And whenever you have an issue affecting this duct, the GGT will increase in the blood. So normal is from 0 to 60 international units per liters, but we like it to be within the tens, teens and tens. So if it's under 10, that's perfect. But it's elevated when you have fatty liver. Alcoholics have very high GGT, and gallbladder disease, like say you have a gallbladder stone, this will be elevated in the blood. So again, the duct that goes from the liver to the gallbladder, and then goes to the pancreas and goes to the small intestine. Whenever this, say you have a stone, a gallbladder stone stuck in that duct, then GGT will be increased because of that. Almost done. Some additional tests that we do, as well as iron panel. Iron panel, normal is from 27 to 139 micrograms per deciliters. And iron is very important. Without iron, we couldn't transport oxygen from one area to the next. So if you ever had iron deficiency, we have tiredness, lack of energy, shortness of breath, poor recovery, impaired performance. So iron is very important. One of the most important molecules in our body. So much so that we have things that carry it. So the liver makes proteins to carry and also to store iron. TIBC or UIBC protein, normal is from 250 to 350 micrograms per deciliters. It is a protein. UIBC is a protein that carries when we take in iron in our diet, the UIBC protein will carry the iron where it needs to go, to the bloodstream, to the blood marrow, the bone marrow, for instance, for the bone marrow to make red blood cells. So UIBC protein is very important in carrying the iron that we take in to where it needs to go. Iron saturation and ferritin is a measure of how much protein, or I'm sorry, how much iron we're storing. And the hepatocytes or the liver cells can store it, but we also have a cell called a macrophage that can also store iron. Normal is from 15 to 55%. Again, iron is very important to our body, that we need stores. And whenever our stores is depleting, that means it's like we're borrowing from the bank and not putting it back. So we're losing iron somewhere, and we have to figure out where we're losing it, either through blood loss, or we're not getting enough iron in our bodies, and we need to basically restore that and replenish the bank. But the bank is very important, just as much as the carrying protein is important. The bank is also important for iron. Vitamins and minerals. One vitamin that we do measure is B12. B12 should be normal from 200 to 900 picograms per ml. And vitamin B12, all the B vitamins are very important, especially for your nerve and nerve conduction. Alcoholics, for instance, they deplete all their B vitamins, or people with diabetes, they deplete all their B vitamins, especially B12. And you cannot have sufficient nerve conduction without B vitamins. You can actually have something called Wernicke encephalopathy if you're low in B1. And a lot of alcoholics, they have the stupor, for instance. When they're low in B1, they can have this this issue with their cognitive abilities. So B12 is very important. B1 is very important. All the B vitamins. We only measure 2 B vitamins B12 and B9. You can measure all other B vitamins, but these are the most important ones that we measure. Or these are the two that we measure, but not the most important ones. So normal is from 200 to 900 picograms per ml, and normally you want it to be 500 to 700 range. And before we get to nutrition, I like to say I've been here for 2.5 years, and I've seen people with B12, their B12 rise or the increase as they stay here for 17 days in the session. It rises, and the reason why I'm telling you this is because doctors will tell you, or in medical school I learned that without meat you cannot make sufficient B12, and I would say that that is not true. People here are on a vegan vegetarian diet, and within 17 days their B12 levels increase, sometimes even double the amounts that they came in with. Within 10 days, we have blood work on within 10 days. So one on day one, and 10 days later, we do another blood work. And we've seen within 10 days, their B12 levels double. So you don't need meats to make B12. Your your gut microbes, excuse me, your gut microbes are efficient. If they make them efficient enough to make B12, you have a sufficient amount of B12. And we'll get to that again when we speak about nutrition. But again, your B12 should be within 500 to 700. But even if you're lower, sometimes vegan vegetarians can have lower numbers and they'll be okay. But if you ever start having issues with your nerves, consider, or even your immune system, for instance, the immune system needs B12 to function properly. So if you ever have issues there, you may need to get a B12 supplement or a B vitamin supplement. Folate is a very important B vitamin as well. Folate is B9, and a lot of women who are pregnant or trying to become pregnant, B9 is very, very important because it can lead to neural tube disorders, neural disorders for the fetus. Some fetus are born with their brains on the outside of their body, for instance, or they're born with, if you've ever heard of spina bifida can be an issue with low B9, or mental retardation could be from low B9 as well. So a lot of the foods that we eat sometimes are B9, the word I'm looking for escapes me, but basically they put a lot of B9 or B vitamins, they supply it in our foods. But normal B9 should be over 3 nanograms per deciliters. And again, it's one of the most important B vitamins that we have in our bodies. Vitamin D is also important. These are the last slides. Vitamin D is also important. And surprisingly, a lot of people in places like the Caribbean, we're low in vitamin D. We have a lot of sunshine, and sunshine is the most important way, or the best way to make vitamin D. When the sunlight hits our skin, it turns the cholesterol in our skin into the precursor to vitamin D. So we start making vitamin D when the sunlight hits our skin. The UVB rays from the sun hits our skin and turns the cholesterol in our skin into vitamin D. Of course, we need the liver and the kidney to help with that, but we need the sunlight to start the process. And if you have a compromised liver or you have a compromised kidney, you'll also not be able to make your vitamin D, but basically you need, to start the process, you need the sunlight. Normal amount of vitamin D you should have in your body is from 30 to 100. The ideal range is from 50 to 70. But we see people, they even do better with, if you have autoimmune disorder, for instance, we see people do better with those diseases when they're even over 100. You don't have vitamin D toxicity until you're over 250 or 260 nanograms per ml. So you can safely be even over a 100 and still be good with vitamin D. We don't know as much as we should about vitamin D. It's actually a hormone. Vitamin D is actually a hormone. We call it a vitamin D, or we call it a vitamin. But it's very important for bone health, for diabetes, for hypertension, for a lot of things in our bodies. And again, we don't know as much as we need to, but it's also for our immune systems. It was shown, for instance, for the coronavirus, that those who had, for COVID-19, for those who had high levels of vitamin D, they were less at risk at getting the disease, but also when they did get the disease, they had less risk of having severe disease. So vitamin D is very important, very key hormone for our immune systems. It also helps us to fight cancer, as I said, so it's very important for our immune system, not just for our bones, not just for other things that we've known vitamin D for, but even for heart health and for fighting diabetes. These things are the vitamin D is very important. Cholesterol and fat. Total cholesterol, normal is 100 to 199 milligrams per deciliters. Ideally, you want it to be, your total cholesterol to be 100 plus your age. So if you're 50 years old, your total cholesterol should be 150. If it's more than that, you can have issues with atherosclerosis, which is basically storage of cholesterol in your bloodstream, and that leads to narrowing of your bloodstream, which can cause heart attacks, strokes, and other issues. HDL is the quote-unquote good cholesterol, and normal is to be 39 milligrams per deciliters. Ideally, it should be over 60 milligrams per deciliters, for men over 65. But the good cholesterol basically helps to clean up the bad cholesterol, or the cholesterol that hangs around in the arteries. So good cholesterol helps to clean up the bad cholesterol, the cholesterol that stays into the bloodstream. Low density lipoprotein, or LDL, is the quote-unquote bad cholesterol. It's a protein that's made by LDL is a protein that's made by the liver, and it helps to scavenge or take up cholesterol from our bodies. But if we have too much of this in our bodies, it could be a bad thing. It can lead to the arteries having issues in clearing cholesterol, and we can have narrowed blood vessels because of it, which leads to strokes and heart attacks and other issues. Normal is from 0 to 99, but ideally we like your age or less than 70. That's ideal. Triglycerides is another form of fats being transported in your blood. And if you have high triglycerides, it can lead to things like increased plaque formation in your blood, or in your blood vessels. It can cause like heart disease or strokes and things like that. Ideally, you want your triglycerides to be your age. So if you're 55, your triglycerides should be 55 or lower. If it's ever higher, it can lead to, again, plaque formation in your artery walls. And triglycerides, you have an increase in triglycerides if you eat a lot of fats, like even good fats like avocados or olive oil or coconut oil, but also sugars. If you eat a lot of sugar, sugar gets it gets turned into triglycerides and gets stored into the liver. So when you get the triglycerides being stored into your liver, you can get what is called, again, fatty liver diseases. So if you have a high triglycerides, you can be sure that you have an issue with your liver as well. Hormones and enzymes. Thyroid stimulating hormone. We talked about hyperthyroidism and hypothyroidism before briefly, but TSH is measured when you have maybe thyroid issues. So if you go to the doctor and you say, I'm very tired, I'm gaining weight, I have high cholesterol, my bones are brittle, they'll start to measure, or even depression. When you have depression, they'll measure the TSH. And TSH is a very important hormone. It's called thyroid stimulating hormone. And again, it's part of the endocrine system. The posterior pituitary gland releases TSH, thyroid stimulating hormone. So the TSH is made by a gland in your brain called the hypothalamus. It's stored in the posterior pituitary gland. And that is sent from this hormone is sent from your posterior pituitary gland, goes to your neck, to your thyroid gland, and tells your thyroid gland, make thyroid hormone. And then your thyroid gland says, okay, I'll make T3 and T4. And if you don't have sufficient T3 and T4, you can either have two things. Either your gland is not making TSH, or your thyroid gland is not making T3, T4. And this is where we have, or the opposite could be true. You can also be making too much T3, T4. But whenever you have a low TSH, it could mean you're hyperthyroid, meaning your thyroid gland is overproducing T3, T4, and it's shutting down the production of your pituitary gland from releasing TSH. So again, your thyroid gland is making too much, so you're hyperthyroid, and it's going to your pituitary gland and shutting down its production of TSH. And if you're hypothyroid, meaning your thyroid gland is not making enough T3, T4, thyroid hormones, your TSH is going to be very high, meaning your pituitary gland is sensing that your body needs thyroid hormones and your thyroid gland is not producing them. So it makes more of it to tell your thyroid gland, hey, listen, you need to make more thyroid hormones. And it sends more and more and more and more TSH so that it can force your thyroid gland to make thyroid hormones. I hope that's clear. I'll answer any questions if you need. Prostate specific antigen, or PSA, is for men. It is not so much a hormone, but it is a protein that's needed for men's health. Normal is less than 0 to 4 nanograms per ml, and whenever it's 4 to 10, you can have an enlargement of the prostate. Whenever it's over 10, you can have prostate cancer. But it's usually measured when men are over 40, 45. More so for Black men, we're 2 times more likely to develop prostate issues than the general population. And my closing scripture is taken from Revelation 12, verse 11. And it says, they overcame him by the blood of the Lamb and by the word of their testimony, and they loved not their lives unto death. So regardless of what our blood says, again, there can be errors even in our blood work. Regardless of what our blood says, we should aim to have the blood of the Lamb. And if we are covered by the blood of the Lamb, nothing can harm us. Even if our blood test does say we have diseases and all these things that we can face in this world, we can overcome by the blood of the Lamb. So I pray that you were enlightened by this. If you have any questions, please feel free to ask. I'll allow like another extra 10 minutes if you need. Any questions, any concerns, any confusion?
Hello?
Yes, Ms. Bodie.
Okay, I have hyperthyroid.
Hyper or hypo?
Hyper, I think it is. Where I'm losing a whole lot of weight. I'm
Okay.
like sweating a whole lot. And it's overworking my heart.
Yes.
And so I need help with that.
Mhm.
I want to get over that because it's now producing too much hormones.
Yes, hyperthyroid. Yes.
Yes, sir.
All right. So I'm gonna go. All right. Let me just connect so I can share my screen. Um, let's share my screen, and then I'll show you how to. So this is the YouTube. Can you see my screen? Can everyone see my screen? Can you see my screen?
Yes.
Yes.
Okay, good. So this is the UT Pines website. Basically, it's so UT Pines, UT Pines, UT spell UCHEEPINES, utpines.org. And from there, you can go to what is called, so click on this thing, you can go to what is called counseling sheets. You can have, there's a lot of things here, talks about COVID-19, lifestyle sessions if you want to come here for a session, training programs if you want to learn more of what we're teaching. Also CMEs, we do CMEs for doctors and nurses and things like that, and so on and so on, other professional seminars and events. But also we have gift shop, things you can buy from us and have it shipped to you. But counseling sheets,
Could you
you
send
go to sorry?
hello? Could you send it to me?
I will. Yeah, I can send it to you as well. But if you go here, yeah, no worries. But if you go here, basically, it shows different things from A to Z, different things. Say, for instance, anemia. It goes to anemia. You can click on this, and it tells you a lot of things about anemia. What is anemia, and what to do to naturally get a hold of anemia. You can also do so. Let's do thyroid. Go to T and thyroid disease. So you go here, you go to thyroid disease, and it tells you everything about the thyroid and um, goiters, for instance. It tells you how to manage certain things like Graves' disease. Graves' disease is an excessive production of thyroid hormones. This is Graves' disease, and this is one of the most common causes of hyperthyroidism. But it also tells you how to treat it, how to treat an overreactive, overactive thyroid. Or if you have an underactive thyroid, it also tells you how to do that as well. Foods that suppress the thyroid function, it tells you what to eat, what not to eat in certain things, in certain cases. What you can do, like a neutral bath, for instance, hydrotherapy, you can use a neutral bath to help with that. What to drink, like drink 8 cups of water daily. This helps as well. Treatment of hypothyroidism, so an underactive thyroid. So this is a very important thing. You know what? I can send me your email. I can send it to you, Miss Sister Bodie.
Okay.
But this is in general. This is a very good site. We have over 500 different. It's for free. 500 different counseling sheets that talks about different things. Aging, alcohol, aloe vera, how to do hydrotherapy, asthma routine, asthma teas, backache, bedwetting, all these from A to Z. We have a lot of things, actually A to Y, sorry. But there's a lot of resources here. It talks about B12, vitamin D, venereal diseases, different things, vaccinations, if you'd like to learn about that. This is a really good resource that I would recommend, again, to everyone who wants to learn these things.
Okay. Thank you.
You're welcome. And yeah, there's a lot of things that I can say, but we can be our own physicians. We don't have to depend on another person. We can, through the grace of God and the knowledge that He gives us on a daily basis, we can in order to heal ourselves. Any other question?
Yes. Hi, I'm new, but I have a question. I was invited by my cousin Jim. So if you're losing a little weight, does that mean it's your thyroid is the issue?
Not really. So yeah, if you're losing weight, you can have hyperthyroidism. If you're hypothyroid, you can gain weight. If you're hyperthyroid, you can lose weight. Because the thyroid gland is, I neglected to mention this, so thank you for bringing that up. But basically, it helps with our metabolism. So if our thyroid is not functioning properly, if it's not functioning properly and it's not making the hormones that it needs, then we'll gain weight because our body's not metabolizing the things that we need, like like using the energy that we need to burn fat, to burn glucose, and so forth and so on. And we can also have high cholesterol or diabetes from hypothyroidism. Now, the opposite is true. With hyperthyroidism, we're using up a lot of energy. We're metabolizing a lot. So we can lose a lot of weight. Even I take in a lot of food, I lose a lot of weight because I'm metabolizing too much of my energy sources, my fats, my protein, my carbohydrates. I'm using up a lot of that stuff. So, but that being said, if you're losing weight, it's not necessarily that you have a thyroid problem. You can have other issues. You can have immune disorder. You can have a liver problem. Some people who need liver detoxes, they cannot gain weight because their liver is not able to function properly. There's other things, other reasons. You can have inflammation. Some people who have like lupus or rheumatoid arthritis, they can cause them to lose weight. So there's a lot of other reasons why you can have even cancer. Cancer can cause you to lose weight. So there's a lot of other reasons why you can lose weight, not just your thyroid gland.
Okay, so for instance, fatty liver could cause you to lose weight too?
Yeah, it can.
Oh,
Because your liver is not working appropriately.
okay. You,
You're welcome. Any other questions?
Yes, good morning.
Morning, Steve.
Yes, I cannot remember hearing you mentioning sickle cell when you were talking about blood, right? What causes the problem, and how best it could be treated?
Yeah, so you're kind of breaking up, but I would say so. Sickle cell is a genetic disorder. Some people are born with sickle cell disease, and essentially, hello, can you hear me?
Yes, I'm hearing.
Okay, so people are born with sickle cell anemia, and um, essentially it's a problem with your red blood cell, and because of in some instances your red blood cells are supposed to stay like this, like as a circle. So I'm getting a lot of feedback. I can't really. I don't know if it's on my side or your side, but I'm getting a lot of feedback. Okay, so the your red blood cells want to stay as a circle, but when they sickle or they become like this, it causes problems in the bone, causes problems in the blood in the body. It can stop blood flow to the bones. It can stop blood flow to the muscles, and that's when people with sickle cell anemia, they have bone pain, they have muscle pain and aches, because the sickle cells are basically stopping the blood flow. They're not allowing blood to go from one area to the next, and you can have even heart attacks or strokes with sickle cell anemia because the blood is being, the blood cell is sickled, and it's basically stopping blood flow from one point of the body to the next point of the body. And there are certain things that causes people with sickle cell anemia to have sickle cell, to have sickled cells, which stops blood flow. So one is oxygen tension. So for instance, if I were to go to a mountain steep where there's less oxygen, then my cells will sickle because I need oxygen to keep that cell from sickling. Number two is an infection. Infections can cause the cells to sickle as well. Basically, using up a lot of oxygen because of the infection. So you need a lot of oxygen when you have a lot of when you have infections or inflammation. You need a lot of oxygen for that process. So our body uses up a lot of oxygen, and when we use up a lot of oxygen, our cells sickle. Or temperature changes. If the temperature gets really cold, you can also affect the sickling of the blood cells. Another problem is hydration. When I don't drink a lot of water, if I have sickle cell anemia, I'm going to have sickled cell because I need the hydration to keep that cell very plumped and round instead of the sickling shape. But also water helps with oxygen as well. So the oxygen will keep the cell from sickling. There are other ways your blood can sickle, but those are like the main ones that causes sickling. I hope that answers your question. I'm not sure if that was your question.
Brother, could you tell me why is it that Black males are prone to have prostate?
Prostate issues, prostate diseases. So honestly, we don't know. We don't know why, especially Black males. I've been trying to figure this out because in my family, my father, for instance, he had prostate cancer, and he had his brother has prostate cancer. His other brothers, they're not even. My brother, my father and his one of his brothers, they're from the same father, but he has 5 other brothers from different fathers, and they have prostate cancer, or prostate issues. His cousin from his father's side had prostate issues, and he died from a prostate issue. My grandfather on my mother's side, he had a prostate issue as well. He died from prostate complications. So in my family, I've been trying to figure out why do Black men have prostate issues? And I haven't been able to find that out. There's no studies that show why are Black men more prone to prostate cancer or prostate enlargement more so than any other race, so to speak. But what I would say is this: it's been shown that, and we'll talk about this when we talk about New Start problems, New Start principles. Nutrition is very important. So what we eat is very important. Exercise is very important. One study showed that when men exercise an hour, 45 minutes to an hour per week, just while walking, it decreased their risk of prostate issues by 74%. So exercise, what we eat is important. Also, our sexual activity is also important as well. It shows the more children we have as Black men, there's more men in general. More children we have, the increased risk there is for prostate issues. So there's a lot of other reasons, well, but I cannot say there is a particular reason why, or that we know of, that causes Black men to be more at risk for prostate issues. A lot of factors.
Okay, thank you so much.
You're welcome.
While on that topic there,
Yes.
is masturbation linked to prostate cancer as well?
Definitely.
Because
Definitely, yes.
definitely, yeah. Because while you're talking there, I was looking up on the prostate cancer, and I was seeing all these things linked on the internet just now there as well.
Yeah, so let me explain that a little bit. So I mentioned about sexual activity, which includes masturbation. So whenever for instance, whenever there's an ejaculate, whenever there's sperm release and all these things, right? We use up a day's worth of zinc, a whole entire day's worth of zinc. And whenever you have a deficiency in zinc, zinc is a mineral. It causes the tissues of the prostate to grow abnormally. So you being low in zinc by masturbation or increased sexual activity or zinc deficiency somewhere, somehow, you can develop prostate issues. Prostate growth, BPH, benign prostatic hyperplasia, or even leading to prostate cancer.
Brother Randall, you're in and out. I think your headphone must be going dead.
Yes. Sorry. Yes, it did go up.
Yeah, you're going in and out.
Yeah. May I?
Yes, sir.
Yes. What can be done to maintain and to restore general health? Because they are almost the average person would have several diseases in the body, some of them which you may not even know about. But then what can we do to maintain and restore general health? Thank you.
Yeah, so starting next Tuesday, we'll talk about the principles of health, the 8 laws of health, and that will basically tell us what we can do. There's a lot of principles, not a lot of principles, there's some foundational principles of how we can maintain our health, but also to heal from diseases as well. Simple things like nutrition, exercise, water, temperance, air, rest, trust in God. These things we can use to maintain our health, but also to cure diseases as well. So we'll talk starting next week. Start with nutrition and show how nutrition can help with maintaining our health, but also cure diseases as well. But if you want to sneak peek, we can do so. Same thing on the website. There's something called New Start. Oh no. So I forget where it is. I think it's 8 laws or something to that effect. But there's something here on the 8 laws of health. If you want to sneak peek, it talks about things like nutrition and exercise and these things, what we can do for maintaining our health, but also healing from diseases. I don't know what is under, but it's here somewhere. It talks about the 8 laws of health.
All right, thank you. Because I know you were dealing with the blood start off with the blood this morning,
Mm-hmm.
and I know that the blood is a vehicle that carry nutrients and minerals and so forth
Mm-hmm.
to the various parts of the body. And if the blood get intoxicated,
Mm-hmm.
then the whole body would fall down.
Yes.
Um, and I was thinking about what can be done to cleanse the blood. What can be done to cleanse the blood? Because spoke also of the thickening of the blood and so forth. What can be done by us in, let us say, in quick terms to cleanse the blood? Because once the blood is cleansed, then there would be once the blood is cleansed, then it is possible for diseases to be reversed, I do believe. But then what can be done, especially to cleanse the blood?
So
Thank you.
we'll talk about that next week as well. Or there's a lot of ways to detox the blood, not just nutrition, but exercise, water. These things can help to detox the body and cleanse the blood. So we'll talk about that more when we get into the New Start principles as well. But yeah, this presentation was just to give you a foundation of what our blood contains, and of course, the life is in the blood, like you said appropriately. The life is in the blood, but the um, the issue is more than just cleansing the blood uh, from and healing from diseases. It's more than that. Okay, I'll take the last two, and then I have to go. The last two, Mr. Anthony and Miss Sandra Meadows.
Well, it's only Sister Meadows because Brother Anthony is the one who was speaking to you.
Oh, okay, all right.
Yeah.
Miss Meadows, you have a question?
Yes, you said something earlier on.
I think we lost you, Miss Meadows.
And I sometimes, and because I was a vegan, I was told I must eat animal product in order to get my iron back up because everything was so low. And I went and back on meat, and I'm going to tell you that messed up my stomach so much that that almost killed me. Because I could not do my own meal, so I have to have somebody to cook for me. And therefore, because the whole consensus was that I have to eat meat in order to live. But yes, it bring my iron back up, but it almost killed me because I hadn't been on it for so long. So I'm glad that you brought out that, once we take our iron and our B12 and all the others, that we can build these things up in our bodies. Thank you very much.
Yeah, no worries. Yeah, so even iron, I think we have a misconception that we need meat for iron. So, and then I will ask, so how was Adam and Eve getting iron? I think the foundation of these thoughts are unbiblical. You can get iron from simple things like moringa. Moringa has a lot of iron in it. It's actually studied to have more iron than the best iron sources, supplements on the market. Dandelion has a lot of iron. Horse chestnut has a lot of iron. Sarsaparilla has a lot of iron. We can use these things to our benefit. even blackstrap molasses has a lot of iron in it. So we don't need to eat meat. It's a farce. It's a misconception that we need meat for iron, for B12, for any sources, and we'll talk more about that next week when we talk about nutrition. These things we have a misconception of how the body works and how God has created this body to work. That being said, let's meet next Tuesday morning, God willing, and I hope that you were blessed by this. If you have any other questions, please feel free to ask me next time we're on, and we can convene next time and try to learn more about our bodies. That being said, I can say a word of prayer and we can close for the day. Thank you for coming, and thank you for having me. Let us pray. Kind Heavenly Father, thank you so much for all that you continue to do in our lives. Thank you, Lord, for this opportunity and the privilege to learn of you and to be healthy according to your ways and good pleasure. Help us, Lord, even now to have the health and strength that only you can provide, and to be healed every which way that we need to be healed, physically, mentally, and spiritually, Lord. Give us this health and healing that Jesus Christ came to give. And I pray, Father, that now you will begin this good work, that we are sure by your word that you will perform even to the day of Jesus Christ, of giving our healing, even our sanctification. Thank you, Father, for purifying us. Thank you for healing us, even from our diseases. And I pray that we will be blessed with health and the knowledge of healing, that we can be a blessing unto others, not only our families and friends and loved ones, but even those to the end of the world. Help us to be faithful stewards of the information and the health that you've given us. Thank you, God, for all things. And may you bless everyone here and everyone who listened, and protect us and guide us throughout the day and throughout the weekend. Help us to have a blessed Sabbath day with you as well. We pray and ask all these things in Jesus' name. Amen.
Amen.
All right.
Amen.
Thanks again, brother Randall, for the opportunity God has given you to share with God's people.
Amen.
Have a wonderful day with you and your family, bro.
Thank you. You too. Have a blessed evening. Blessed day.
Yep.
Bye-bye.
Bye-bye. Bye-bye, everyone.
Bye-bye.
Bye.